Hi, I'm Dr. Paula Varnado-Sullivan. I'm the Department Head of Psychology here at Southeastern Louisiana University. Welcome to General Psychology 1, Introductory Psychology, or as we like to call it here, Psych 1010. This basically is a course where what we want to do is give you a good foundation in psychology so that you can have a nice understanding of what psychology is and what we do. So I wanted to start with a little bit about, what exactly is psychology? When I ask people to think about what is a psychologist and what do they do, people tend to come up with a very similar answer. Most people think that psychology has to be about mental health and therapy. Now, in all due diligence, there are a lot of psychologists that are clinical psychologists or other branches of psychology that work with mental health. I'm a clinical psychologist. I specialize in research and treatment and work with folks who have eating disorders, mood disorders, and anxiety disorders like obsessive compulsive disorder. But that is not all that psychology does. It is not just about mental health and doing therapy. And no, we don't all look like Sigmund Freud. In general, what psychology is the study of human behavior, emotion, and mental processes or thought processes in pretty much every aspect that we function. Well, basically what makes us us and how do we work. Now, a lot of textbooks break this definition down a little bit differently. Some talk about behavior, emotion, and cognition or thought processes as a little bit sort of different things. This textbook lumped it into behavioral mental processes. But at the end of the day, what we're studying is basically looking at human behavior, what we can observe, how we think about things, how we process information, how we remember material, and also how we react, that emotional reaction to things. And we use the empirical method or the scientific method to determine and to study those things. So when I mention I do research with things like eating disorders, depression and anxiety, mostly with eating disorders or the stigma of psychological disorders, I studied things like body image concern and differences in body image concern experienced by men versus women. So we're trying to understand human behavior, and then sometimes we develop ways to sort of intervene and try to make changes or help people with different aspects of their functioning or things that are giving them trouble. But in general, psychology studies all aspects of human behavior, not just mental health. So this is a slide from the textbook that talks about the different branches of psychology, and I'm not going to talk about all of them, but I wanted to give you a little bit of an idea about sort of the breadth of things we study. So for example, on this slide, it talks about physiological psychology. Physiological psychology studies basically all aspects of brain and central nervous system functioning and how that impacts things like the areas of the brain that identify things like the areas of the brain that are responsible for memory or language. Sometimes that study does involve mental health, but sometimes it's basically just, for example, how we process things like, what we see. And that's the sensation and perception part, actually. If I see it, how do I make sense of it? So physiological psychology, for example, the physiological psychologist who's on faculty here, he looks at everything from pain perception to how we deal with sort of how our body processes exercise. And how exercise impacts us and helps us deal with stress and things like that. Cognitive psychology is a branch of psychology that focuses on those thought processes and how we process information, how we remember things. Developmental psychology is really fascinating because it studies psychology or how we change from the moment of conception until death. Some developmental psychologists focus on early areas of early childhood, like infancy through early childhood. Others study adolescence. Some focus on what happens to us as we get older. There's also a whole other branch of psychology that is called geropsychology that just looks at how we are and how we adapt and how we function and when we approach those elderly years. Other branches of psychology, like personality psychology, are just trying to define the different aspects of, what we call personality. And not just like you have a good personality or bad personality, but looking at things like extroversion and what exactly does that mean and how do we define it and how do we measure it. Social psychology is the study of essentially how society and those things outside impact the individual. Clinical psychology, we've talked about, that's the branch that basically focuses on mental health. Clinical psychologists sometimes focus on, like one of my colleagues here is a child psychologist, so she works more with kids. I work with adults. So counseling psychology is another branch of psych that also focuses on mental health. We just tend to approach it slightly differently and usually focus on different mental health concerns. Industrial organizational psychology is pretty interesting as well because it actually looks at how we function in the workplace. And it involves everything from, I've worked with industrial organizational psychologists who study things like work-life balance. That's what our industrial organizational psychologists here at Southeastern studies, sort of that, are we balancing the fun aspects of life with our career? I also worked with someone who worked at NASA, and they were essentially developing measures to determine who was the best astronaut applicant candidate so that they made sure that they basically selected the best candidates to actually train to be astronauts. Let's see what else. Oh, school and educational psychology. School psychology is usually that person it's not the guidance counselor, it's more the school psychologist who's working with folks who have, for example, might have mental health issues or learning issues, ADHD, and working with them in the school system to help them maximize how well they do in school. Forensic psychology is always very popular. It's actually the intersection of psychology and the law. It's not just profiling, it's pretty much any aspect where psychology and the law would interact. Sometimes forensics would be sort of like what you see on TV, more profiling and helping to identify or catch criminals. A lot of times, though, forensic psychologists are sort of expert witnesses. One of the neuropsychologists that I worked with, he actually a lot of times would be an expert witness in lawsuits to determine essentially like how much difficulty and damage had been done after an injury, and when the patient would be suing, for example, a company. And so, but forensic psychology can be sort of a broad approach and a broad thing. And like most psychology, there's just a lot of different aspects to it. So psychology in general is actually a very broad field. It looks at everything from how we perform in sports situations, including like performance issues in sports, through mental health, through how we develop over time. It's not just about mental health, and it's pretty applicable to almost anything we do since we're, like I said, studying humans. Thanks.